In this lecture, we are going to discuss the most important cardiac marker, that is troponin. We will discuss the different types or the difference between the troponin T and the troponin I. Along with that, we will discuss some clinical scenario. So let's get started. Cardiac troponin T is represented by the cTnT and the cardiac troponin I is represented by the cTnI. These are the proteins present in the muscles of the heart, that is cardiac muscles. Whenever the cardiac muscle damaged, in that case, these protein released into the blood, and from the blood we can detect these proteins, and as a result, we can check MI, myocardial infarction. In that case, you will see the necrosis of the heart muscles. So cardiac troponin T, trop I, binds to the tropomyosin, another protein present in the cardiac muscles. It actually stabilizes the troponin complex with the tropomyosin, while the trop I inhibits the actin and myosin interactions. Actin and myosin interaction, after actin and myosin interaction, you will see the contraction of the heart muscles. But trop I inhibits the actin and the myosin. These are also the protein present in the heart muscle. It inhibits the interaction of the actin and the myosin. Trop T has different isoforms that can be present in the cardiac muscles and the skeletal muscles, while the trop I is specifically related to the cardiac muscle. So trop I is more specific related to the cardiac muscles as compared to the trop T. But both can be used for the diagnosis of the MI, myocardial infarction, but trop I will be the specific one because trop T can also be increased in other scenarios as well. So after the MI, myocardial infarction, trop T rise in 3 to 6 hours. Similarly, trop I will also be raised 3 to 6 hours after the MI. Peak value will be 12 to 48 hours trop T, and the trop I is 12 to 24 hours. It means that the peak value, durations of the peak value will be more in the trop T as compared to the trop I, and it will remain rise for 10 to 40 days in case of trop T. But in case of trop I, this will be durations of the trop I will be 5 to 10 days. So it means that if we want to check the MI, whether the patient has been affected by the MI, so we can go towards the trop T because it will rise for a long duration, 10 to 14 days. So it will be helpful in the late diagnosis. While in the trop I case, you will see it is good for the early because it can be its durations of the trop I is small as compared to the trop T. Trop T can also be rises in other scenario like CKD, chronic kidney disease, and the skeletal muscles disease as well. But this will not be the same for the trop I. It will not be increase in chronic kidney disease and skeletal muscle disease. So trop I will be helpful in distinguishing between the cardiac and the non-cardiac region, and the value of the trop T is less than 0.01 nanogram per ml, and the in case of trop I you will see the less than 0.04 nanogram per ml. Now we will see some scenario that will be helpful in understanding the difference between the trop I and the trop T. First scenario is 55-year-old man presents with severe central chest pain radiating to the left arm for 4 hours. This has been happening for 4 hours. ECG shows ST elevation in leads 2, 3 and AVF, and the trop T is elevated. Trop I is also elevated in that case. So what will you think about it? 4 hours. So as we have discussed, rise of the trop I and the T will be 3 to 6 hours. So it means that the patient has been facing this problem for 4 hours. So it means that 4 will be lie between the 3 to 6 hours. So it means that trop T and the trop I has been released if the heart is affected into the blood. So in that's why trop T and the trop I after doing test is elevated. And ST elevation also be seen in that case in the ECG. So it goes towards the myocardial ST myocardial infarction. ST elevation myocardial infarction. Next scenario is a 60-year-old man with end-stage renal disease. He has a kidney problem, no hemodialysis presents for routine checkup, no chest pain, ECG is normal. But trop T is high and the trop I is normal. So as we have discussed, trop T can also be elevated in the other than the cardiac reason, like the kidney disease. So that's why trop T is elevated due to the kidney problem, not due to the chest problem or the heart related problem in that case. Trop I is normal. So that is another important thing that distinguish between the trop T and the trop I value. Third scenario is a 48-year-old woman presents 10 days after an episode of chest pain that resolved spontaneously. Trop T is elevated while the trop I is normal. Why? That is an important thing. Episode's time is 10 days after. So we have already discussed the duration. Trop I will remain in the blood for 5 to 10 days. But this woman is presented to the clinic after the 10th days. So it means that it will start normalizing after the 10th days episode of the chest pain. But trop T will be elevated because the durations of the elevations of the trop T is 10 to 14 days, more than 10 days. So that's why in that case, trop T is elevated while the trop I is normal. So that's the reason behind the trop T and the trop I. So this is the important thing or the important difference regarding the troponin T and the troponin I. So if you still have any question, you may ask in the comment section. Thank you so much.